Hello, Dr. Cisse covering anatomy and physiology. Today we'll talk about chapter 7 and 8. We're going to review them. We'll talk about bone tissue and bones. On the left side here on top, you see small bone getting big from hyaline cartilage to compact bone. On the right, you see bone tissue with osteon and central canal in the middle. The bottom, you see the tibia and fibula here. Tibia tough, fibula fine. And then you see the femur on the right. So let's talk about bone tissue and organs of the skeletal system. We know we have 11 organ systems, and the skeletal system is one of them, made of bones, cartilages, and ligament. And the bone tissue is one of connective tissues. In general, we have four main types of tissues: epithelial tissue, connective tissue, muscle, and nervous. So bone tissue is a type of connective tissue. Why? Because it's made of ground substance, cells, and fibers, which is, how connective tissues are made. So beside bones, cartilages and ligaments are part of the skeletal system. Now, ligaments are made of connective tissues. What type? Dense, regular connective tissue, just like tendon. But tendons are not part of the skeletal system. They're part of the muscular system because tendons attach muscle to bone and ligament attach bone to bone. So we say the connective tissue are made of cells, ground substance, and fibers. So bones is a type of connective tissue. Each bone is considered as an organ because we say systems are made of organs. So bones are organs of the skeletal system. What is the function of the skeletal system? Support, we walk on bone. Protection, the brain is protected in the skull. Movement, bones are moved by the pulling of muscle. Storage, calcium and phosphate and different minerals are reserved in bone. Acid-base balance, buffer blood against large pH change by altering phosphate and carbonate salt level. So the bone is like a saving account. And blood formation. Bone marrow is the chief producer of blood cells. It produces blood cell, but it does not store blood cell. It only produces it. So what are the general features of bones? We have different types of bone: flat bones, long bone, short bones, and irregular bone. Irregular just means it has no particular shape, like, for example, vertebrae. And short bones are just shorter, long are long, and flat bone like the skull, Patella, the temporal bone, occipital, all those are flat bones. So adult long bone will have different parts. We need to know what is epiphysis and diaphysis. We need to know the difference between compact bone and spongy bone. We need to understand where is the bone marrow located. Articular cartilage, what is that? And the periosteum. These are things that we need to know. Let's talk about them here. So this is the bone. What bone is this? The femur. You can see the big head. You see the greater trochanter, the lesser trochanter. Of course, on top, you see the epiphysis, the bottom epiphysis, that's called like the head. And in the middle, you see the diaphysis. The yellow bone marrow is in the bone, inside the bone. So yellow because it's adult bone. Now, the periosteum, you see perimeter, periosteum, means around the osteum, around the bone. It's the cover, it's the connective sheath that cover the bone here. The endosteum, endo, inside, is the inside lining of the bone cavity. So they have the periosteum, the endosteum, epiphysis on top, epiphysis here. And then you see the epiphyseal line. It is the line here between the head, you see here, and the great trochanter, and the rest of the bone. This is where growth used to happen when this person was young, and it got ossified as they get older. So this epiphyseal line used to be a larger epiphyseal plate from which bone grows and then eventually stop growing when the adult reaches its normal height. So on top of the bone, we have hyaline cartilage, right, that cover the surface of the bone. We also call that articular cartilage. Now we know what is the periosteum, is the external covering of the bone, and osteum is the inside lining. Here you see ossification. What is ossification? Is the formation of a bone. Endochondral ossification is the ossification, it's the process of making bone from cartilage. What type of cartilage? Hyaline cartilage. Now you see the hyaline cartilage in blue here. This bone is like a formation of primary ossification center. It's like a young bone growing into the adult bone. Now you see all the blue hyaline, there is being ossified, becoming bone. So during the bone formation, because the hyaline used develop into bone, during the transition from hyaline to bone, you will see here we have the blue getting smaller. That means the hyaline is getting smaller because the bone is getting more ossified. During that time, you see a transit area between the epiphysis, the top of the bone, and the diaphysis, the shaft of the bone. This area is called the metaphysis. That's why the metaphyseal plate will be a transitional area between the spongy bone of the epiphysis and the compact bone of the diaphysis. Okay? So we need to know, of course, bone elongation. When bone gets longer, right, it elongates by transforming the hyaline cartilage into ossified, calcified bone. You see the metaphysis, which is the one of cell proliferation. So proliferation of cell, right, happens at the metaphysis, the blue area of the cartilage. Now, chondroplastic dwarfism. Chondro means cartilage. Is the epiphyseal plate does not grow. People who has chondroplastic dwarfism syndrome do not get tall because the epiphyseal plate here, the chondrocyte, the cartilage, the hyaline cartilage, does not grow into bone, does not change into bone, so the epiphyseal plate closes very early. So this is the intramembranous ossification. For flat bone, the bone develops from bone cells into bone. It does not go through the hyaline cartilage. We call that intramembranous ossification. In bone widening and thickening, right? So when you grow and the bone, you reach, for example, if you're 14, 16, you reach, or 20, you reach your height, or the height you will not pass, the bone will get thicker. That's why when you're 22, 23, you kind of look skinny. As you get older, you get thicker. That growth is called oppositional growth. It occurs at bone, mature bone surface. So it's a continual growth in diameter and thickness, right? So we call that oppositional growth. It happened through intramembranous ossification too, because during the growth of, for example, the skull, the bone gets thicker, right? Bigger and thicker, right? So let's talk about the bone cell. Of course, we say the bone tissue is connective tissue. So it has cells, ground substance, and fiber. What type of cells? Osteoblast, osteocyte, osteogenic cell. So the osteogenic cell are the stem cell that grow into osteoblast, which is a bone-forming cell, and then those grow into osteocyte, which are the mature bone cells. So the cytoplasmic processes of osteocyte reach into canaliculi and contact processes of neighboring cell. Let me show you the picture here. So the osteocyte, which are a grown, mature osteoblast, live in the little lake called lacunae with long, thin, finger-like processes that kind of have run through a canal called canaliculi so that the bone cells can communicate between each other. So osteocytes are in the lacunae. They have processes. They're a grown, mature bone cell. Younger cells are called osteoblast. What about the osteoclast? The osteoclast are bone-dissolving cell found on bone surfaces. These are bone cells that break up the bone to release calcium when we need to release calcium when the calcium level is low. So they have greater number of lysozyme. Why do you need the lysosome? Why do they need lysosome? Because they need to dissolve the bone to release minerals or calcium into blood in case of deficiency of those minerals. The osteocyte and osteoclast do not develop the same way. The osteocyte are just osteogenic cells that develop into osteoblast and into osteocyte. You see all the branches here. But the osteoclast develop from stem cell into osteoclast to fuse, many of them fuse, and then they eventually secrete a lot of lysosome to dissolve the bone to release minerals from the bone into blood. The compact bone schema you see here, you have a central canal in the middle and the lamella, which are just a walls that build up the bone. The central canal is in the middle of the ostia of the compact bone. But this is the spongy bone. Spongy bone does not have a central canal. It has trabecula, just branches. What is hypocalcemia? Low level of calcium in the blood. Not in the bone, in the blood. Because everything we test on human, we give blood. We don't give the bone to test stuff. So that's why when we say hypocalcemia or hypocalcemia, we talk about blood. Low calcium level hypocalcemia causes muscle spasm. Now let's talk about the skeletal system. So because we are talking about two different chapters in this review, we need to understand what is a process, a sutural bone, sinus, foramen, meatus, fissure, and fossa. Let me explain each one very quick. The process is extension of the bone, right? It's a extension. It's like for example, styloid process, mastoid process, zygomatic process, just extension. A foramen is like a hole in the bone through which you have nerves and blood vessel going through. Meatus is like a hole with no end, external acoustic meatus. A fissure is like a slit, like an opening. For example, supraorbital fissure. Fossa is a hole that through which something goes in. For example, mandibular fossa on the temporal bone. For example, mandibular fossa. A sinus is a air-filled space. For example, the bones on the facial bones, for example, the maxilla, the ethmoid, the sphenoid, and the frontal bone have sinuses, right? Maxilla, frontal, sphenoid, ethmoid have sinuses. Air-filled space, like an empty space in the bone that has air running through it. So what else? The sutural bone. Between the suture, like coronal suture, lamellae suture, sagittal suture, squamous suture, we have pieces of bone called sutural bone. It's different than sesamoid bone. The sesamoid is like a bone that grows between tendons. For example, the patella. What about condyle? At the end of long bone, any two surfaces that touch, or a surface of bone that touch another bone is called a condyle. For example, the condyle of the femur, the condyle of the tibia. And the epicondyle is a process above the condyle. So we talk about sesamoid bone, we talk about fossa, tubercle or trochanter. Like extrusion, like some kind of bump on the bone. For example, if you take the humerus, we have greater tubercle and lesser tubercle. But if it gets bigger, we call it trochanter. For example, the femur has a lesser trochanter and greater trochanter. The sulcus is like a little passage between places. For example, the greater tubercle and lesser tubercle has a sulcus, intertubercular sulcus. Like a process we talk about, foramen is a hole, again, with the nerves and blood vessels. Here you see the orbital, the skull bone of the orbit. Now you need to know everything here, obviously, the vomer, the mandible, you need to know everything. And then you need to know the ethmoid bone is in the middle. And you need to understand that the nasal bone is now part of the bones that form the eye socket. You can see here the frontal, the zygomatic, the maxilla, you're going this way, right? You even say the ethmoid bone here, right? Your sphenoid bone here. You see the lacrimal. But the nasal bone is not, because the maxilla goes up and touching the frontal bone, which blocks the nasal bone to be a part of the eye socket. Here, the suture. The parietal bone, which is here, has the most suture because it had the frontal suture, the squamous, the sagittal, and the lambdoid suture, the four sutures. What is the fontanelle? It's the space between unfused cranial bones of babies, right? Look at the scapula. We need to know something about the scapula. The superior angle, inferior angle, lateral angle, the spine, the acromia, and the coracoid process. Remember the process, again, is an extension of the bone. The pelvic girdle and pelvic outlet. You need to understand the spine of the ischium is right in the middle. It forms the pelvic outlet. The distance between the, you see here, the pubic symphysis here to the sacrum here, the coccyx here. This distance is the pelvic outlet. And the pelvic inlet is going to be this pubic symphysis up to the sacrum here. And the acetabulum is the socket in which the femur goes into. The head of the femur goes into the acetabulum. Here, the right femur and the patella. So you need to know everything about the femur, obviously the head, the neck, greater trochanter, lesser trochanter, and the condyle and the epicondyle. You got the medial condyle, lateral condyle, and the patella. On the tibia and fibula, you see the fibula is fine, the tibia is tough, and the tibia is medial, right? The tibial. So the surfaces on the tibia and fibula, anything that's lateral, we can touch, we can palpate. Anything in the middle part, we cannot palpate if it's between the tibia and the fibula. Now, I hope this is going to be helpful. Now, this is very important for you to know the picture on the left here. The hyaline cartilage, right, is the precursor of the compact bone. And then you need to understand the epiphyseal plate. And when it grows, and when the bone is completely grown, you see the epiphyseal line, right? All right, so I hope this is helpful, and I'll see you in class.